Welcome to Doctors on Call. I'm Jenna Miller. Pet owners spend more than $65 billion on their pets every year in the United States, according to the American Pet Products Association. Nearly 80 million households own at least one pet, and of those owners, at least half of them buy gifts for their furry friend, whether it be for Christmas, their birthday, or just because they love them. It's no wonder when your pet shows unconditional love and rarely asks for anything in return. But how can you assure you give your pet the best life they deserve? Joining us tonight to answer that question will be Dr. Brandon Wiedenhaft.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.
Pet health is our topic this evening on Doctors on Call. Please take this opportunity and call 800-337-4788 with your questions. Dr. Brandon grew up in Stockton, Kansas and graduated from Kansas State University in 2001. He has been caring for animals in the Hayes area and opened his own practice, Big Creek Veterinary Services, in 2012. He provides large animal, equine, and small animal services as well as 24-hour emergency services. Give us a call at 800-337-4788 toll-free with your questions about your pet on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or veterinarian. Thank you so much for joining us, Dr. Brandon. We'll wait for those phone calls to come in and start on some of our own questions.
Sure. Thank you
Let's
for
talk
having
about,
me.
absolutely. First of all, let's talk about how often you recommend regular wellness exams for your pets.
Most of the time we recommend yearly wellness exams. Even if they're not in need of any other things, we like to see them once a year, give us an idea of what is baseline, so that we know if there's a problem in the future, we kind of have an idea of what normal is for each pet. So.
And what can an owner expect when they come into your office? What those wellness exams will look like?
Most of the time, it's just a good physical exam. We'll listen to the heart and lungs. We'll check their teeth. We'll check their eyes, look in their ears. Take a temperature just to kind of make sure everything is going normally. Like I said, it gives us an idea what normal baseline is for that pet, and we'll make note of it. Maybe there's things that we need to watch in the future, and we just kind of make notes of those types of things. It's usually really fairly a quick in and out. We just do a checkup, make sure things are normal. So.
Sure. Now you mentioned teeth. How important is to keep your pet's teeth clean?
Well, dental health is a big factor with the overall body health of the pet. Small dogs seem to be prone to having more dental health issues than bigger dogs. A problem in the mouth can lead to problems elsewhere because bacteria can enter through gum disease or through tooth decay, enter the bloodstream, call it septicemia, and can lead to other problems elsewhere in the body because we got bacteria that are literally swimming through the bloodstream. So, dental health is an important thing, and actually Dental Health Month is coming up in February. So.
Excellent, good timing. What does a pet owner need to do in order to keep those teeth clean?
At home, there are pet toothbrushes and pet designed toothpaste that they can attempt to brush at home. It's maybe successful for some pets and not at all for others. There are chews and specialty foods that are designed to help kind of clean the teeth as they chew. It kind of helps break down the tartar and calculus and stuff that builds up. Basically just, the grinding action will kind of scrub the teeth. So there are those things that help with with the health of the mouth. If things get beyond things that can be controlled at home, we do dental cleanings, and where we actually will sedate the pet, clean the teeth with a scaler, and then polish the teeth and that sort of thing. So,
Are there any risks involved in doing that?
anytime there's anesthesia involved, there is some risk. We minimize the risk by monitoring the patient as closely as possible, and you know, pre anesthetic blood screenings if necessary, and those types of things. If the dental decay is excessive and we have to remove teeth, generally there is risk that there could be more bacteria released into the bloodstream, things like that. We will generally prescribe a take-home antibiotic, maybe pain medication as well, following dental procedures that get invasive. So,
Excellent. And humans, we brush our teeth every day. Is that
Sure.
something that's necessary for an animal?
you know, if the pet tolerates it well, it's definitely not going to hurt anything to do it daily. If the pet will allow you to do it even weekly, it will help minimize that buildup of tartar, and space out the time needed for the full, you know, sedation, dental cleaning, and all of that. You know, you can stay ahead of it a little bit more if you work at it. So,
Excellent. Do you accept pet insurance at your clinic?
we do. There's pet insurance generally, the ones that I've dealt with. You come in, you have your pet examined, you pay your fees, then you take your invoice and you submit it back to your insurance company, and then they reimburse the pet owner for that. So to specifically say we accept it or don't accept it, we do, but a lot of it is more of kind of a reimbursement back type thing.
So do you feel that it is worth it for an owner to get pet insurance?
It is. It's worth it, especially if you have an accident-prone pet. Some large breed dogs and stuff are just a little bit more rambunctious, you know, more likely to maybe sustain an injury or something along those lines. I've never ran across a person who invested in pet insurance who felt at the end that it was a waste of money or a waste of time. Everybody that I've ever dealt with has always had a good experience with it, have nice things to say about it. It at our clinic anyway is rare. We don't really have a lot of patients who are on pet insurance. We actually carry some like brochures advertising some different ones in case somebody's interested in it, but it's just not a super common thing.
Okay, great information. We're going to go to the phone lines now. We've got Linda on the line from Codell. Hi, Linda. Go ahead with your question for our vet tonight.
Hi, I'm going to back up to your teeth question and wondering, I know we hear a lot about dogs, but what about cats? I've got a variety of pets, hamsters, gerbils, alpacas, horses. Do you also need to keep those animals' teeth clean, or are dogs just the ones that are more prone to getting their tartar and all? Thank you.
About half of the dental cleanings we do are on cats, and the other half are on dogs. Cats are prone. Cats also have some viral diseases that can cause extreme gingivitis and dental health disease. Going to the alpacas, I have actually had to trim down the insides of their teeth on alpacas before. As they aged, they had overgrown a little bit, and we used a Dremel tool and cleaned those teeth up a little bit. I do a lot of horse dental floats. So horses are another species that we frequently will work on their teeth, examine their teeth, and make sure that they're in good health. I've never really experienced problems with hamsters and gerbils and the small pocket pets. Never, I guess, seen an issue there, but I suppose there's always the possibility to get an abscess tooth root or something like that, even in the pocket pets. So.
Okay, now we're talking about very small animals compared to very large animals.
Sure.
What do you usually see in your clinic?
We see everything. It depends on the day. Like today, I was mostly doing large animal I am the cell barn veterinarian for the Heartland Regional Stockyards in Plainville, and so I was at the cell barn for most of the day today. So for me today was a large animal day. Talking about my associate veterinarian, Dr. Poland, William Poland, he was at the clinic today, and he mostly did small animal. We did some spays and neuters and things of that nature today, and he saw some appointments. So it depends on the day, but we truly do everything, large and small both. So.
Okay, we're going to go back to the phone lines. We've
No
got
problem.
Kathy on the line from Hayes. Hi, Kathy. Go ahead with your question for Dr. Brandon.
Hi, I was just wondering what the best thing to do is when your pet has a tick on them.
Okay. To remove a tick, the best thing to do is use like a tweezer or forceps, something you can get a hold of it with. And if you put steady, gentle pressure on it, its mouth parts will weaken and tire, and it'll let go eventually. It's better to hold pressure on it for a moment, maybe a minute, and let it kind of weaken and tire and let go than it is to just try to yank it, because you could potentially pull the head off and it would remain attached to the skin, which could lead to maybe a skin infection or something along those lines. But if you get a hold of them and hold pressure on them, they will get tired and let go.
Now, I've heard of, I don't know if there's any truth to it, but Vaseline or essential oils you can put and they'll sometimes release on their own. Is there
Right.
any truth to that?
Well, there is some extent, because even insects are breathers. They require oxygen. So by putting a film of Vaseline over them, they will eventually have to start to look for a way out, and they will back off. But it's hard to keep it on there on a pet. It's certainly possible, but
Sure.
it would take time.
Now, we're kind of in the colder months right now, but our flea and tick meds, do you encourage your patients to use those, or your clients to use those even during the colder months?
I'm pretty flexible on it. I leave it up to them. Truly, we don't see a lot of fleas and ticks this time of year, but yesterday it was 61 degrees outside. So there is the possibility for them to be out. If we had 30 days in a row where it got to 30 degrees, we're not going to see a problem with fleas and ticks. If you have an outdoor pet and you have the doghouse stuffed full of hay and straw, it's possible for fleas to survive in that bedding, and so then you could potentially run into a problem. But I don't try to push them into using the product year round. I really leave it up to them and let them decide. It doesn't hurt them to leave it on year round. It may not be necessary, but once again, you get several days of 60 degrees, and fleas and ticks can be back out even in January or February. So.
Do you have any cold weather tips for smaller animals?
I think the biggest tip is just to provide them adequate housing out of the wind, something with insulation, whether it's bedding. Larger outdoor dogs would be sufficient with straw bedding or hay bedding. The smaller pets probably would benefit more with something with a stuffed insulation in it if they're going to be outside during the day. But protection from wetness and protection from the wind are very important. They can tolerate pretty well if they have protection from the wind and from dampness. So.
And what kind of advice do you have for maybe those that are farming or for the larger animals?
It's difficult for guys to get a herd of 250 cows all in the barn. But once again, providing windbreak and bedding. Most cow guys will have straw bedding and that type of thing to bed their animals down in, and cows can tolerate pretty well if they've got a windbreak and bedding, not necessarily even a roof over their head, but just to have something that they can lay on, get off of the specifically frozen ground and that sort of thing. So.
What shots do you recommend for your clients with their pets?
Okay, we do a series starting with puppies or kittens. We'll do 6, 9, 12, and on puppies 16 weeks. And the vaccinations that we do at that time will have parvovirus, parainfluenza, distemper virus, hepatitis, It's a combination. We use coronavirus and we use leptospirosis in our vaccinations. And each one of those vaccinations boosters them to improve that immune response. We do rabies at 12 weeks or older, and we booster all those vaccinations 1 year from their last puppy series, and then every 3 years after that. With cats, we do the combo feline vaccine, and it's like a 6-valent vaccine as well, and we do them at 6, 9, and 12 weeks, and rabies at 12 as well, and then booster 1 year, and then we do every 3 years after that. So,
Now, you mentioned coronavirus. Let's clarify that this is different than the coronavirus that everyone else
Sure.
is struggling with.
Right, absolutely. So the coronavirus that's in the canine vaccine is a coronavirus that causes a diarrhea, stool issues in young dogs, puppies especially. So that strain of coronavirus is not the same, and it's one that's we've vaccinated for it for years. It's been in the combination vaccine I've been at this for 21 years, and it's been in there for at least 21 years. So.
Sure. So there's no way for an animal or a human to pass coronavirus back and forth from one another.
Well, so we're going to get into the coronavirus that type, or the coronavirus that the humans are having issue with right now, because it is possible. It's not likely, but it is possible for the SARS-2 coronavirus that people are dealing with right now to go to pets. It's not, like I said, it's not common, and it's not like easily passed, but it is possible. With pets, the symptoms are very similar to humans, kind of coughing, congestion, and one of the common things in dogs especially is vomiting and or diarrhea. And so it can mimic many other things in our pets. And I wouldn't be surprised that we haven't seen some pets that have been not feeling their normal self, running a little fever, that may have been exposed to the human coronavirus through the owners at home. I have not gone to the trouble of testing any pets because I'm not going to find out for about 3 days. And so, we go ahead and treat the symptoms, and we've had good success with cleaning up whatever is ailing them without specifically knowing that's what it is. So I don't want to freak anybody out, but it is possible, but it's not likely. So
Is it contagious then from one dog to another?
it doesn't seem to be. It's contagious from pet to pet, and it's not very contagious from pet to human or from human to pet. But there is some research that has shown that it's possible that a pet can carry that in their nasal passages, and if they coughed right specifically in your face, it is maybe possible that it could be transmitted from person to pet to person. That's possible, but it's not highly likely.
Sure, very interesting. Are there any side effects that a pet might experience after receiving their vaccines?
There are two common things. One is an anaphylactic reaction that can occur. It's not common, but it can occur, and that's going to be like swollen face, puffy eyes, typical reaction of hay fever type thing. Watery eyes, puffy face. We usually will give them a little bit of Benadryl, and it'll go away with a few hours, and they're fine. The other reaction we'll see occasionally is it just seems like they're tender and painful, and where we give the injections, if you are petting or touching, they seem to respond as painful, and generally they're over that within 24 to 36 hours. And occasionally you'll get a little bump where the vaccination was given, just the body reaction to the shot, and usually that little bump will go away in a couple weeks.
Sure. We want to remind our viewers that we are talking about pet health tonight with our veterinarian, Dr. Brandon from Big Creek Veterinary in Hayes. So if you have any questions for him, give us a call at 800-337-4788. Let's talk about heartworm and what the risks are with that.
Okay, we do have heartworm in our area. We usually will see 1 or 2 a year. Risk associated with it is right-sided heart failure. If they have a large worm burden, it can cause outflow obstruction in the heart. So we try to routinely test for heartworm disease. Now, the tests that we commonly use actually only test for female because of the antigen associated with a female worm. And so there's the slightest possibility that you could miss one. But it's a pretty fail-safe test, and it's kind of like casting a big net out there and reeling in all the fish. Whether you're specifically looking for a trout or a walleye or whatever, you're going to catch everything, and then you can kind of do a confirmation test of that. So if you look at the cost of putting your pet on HeartGuard for its entire life versus the cost of having to treat your pet if it becomes positive for heartworm, it's pretty much the same cost. One is immediate with large amount of side effects. The other is spread out over the lifetime of the pet, but the cost is about the same.
Sure. And what about deworming a cat? Is that necessary?
We do. It depends on lifestyle. Some cats are outdoor, indoor. They like to go out the back door and hang out in the backyard. Potentially they catch rodents and things like that. We do have options on deworming cats. We have oral medication and topical. So there are topicals now that will get rid of all internal parasites by placing on their back. So we try to deworm pets about once a year, depending on lifestyle. Like I said, some pets that are frequently in the country or on a farm or whatever probably get done 2 or 3 times a year because they're a higher infestation rate. So
Let's talk about the health risks of aging pets.
okay, I know a lot about that. I have a 16-year-old Weimaraner right now,
Okay, so
she's
tell us,
aging.
what do we have to look for on that?
I think as they age a little bit, it's a good idea to do some routine blood screening. It gives you an idea on the function of them, how their kidneys are functioning, liver functioning, and things of that nature. After we've done that, we talk about having adequate nutrition, not letting them get overweight because it can put undue stress on hips and backs and things of that nature. Like my dog, she's definitely aging. She has some issue with congestive heart failure. She takes medication every day and has for a couple years now. As they age, there definitely is some things that happen. So it, I guess, kind of depends on specifics, but nutrition is important for aging pets, and maintaining some exercise and that sort of thing is good for them to just kind of keep going. So.
Sure. And you mentioned weight. If you have an animal that is overweight, what kind of advice do you have to try to get that down?
The biggest thing is work on trying to get a little bit of weight off. Obviously with pets, if you feed them less, they're gonna slim down a little bit, but that's a difficult thing to do. You don't want them to walk around looking at you like they're starving. So there are things that we can do, light foods and weight management foods and things like that to help try to control the weight issue. To be honest, we see more pets that are overweight than pets that are underweight. And so, exercise is always good for weight management. So it depends a little bit on the situation, but things that we try to do to help is diet and exercise. This is like people. So
What are some signs of arthritis in your pet, and can weight affect that?
sure, arthritis, reluctance to do the things that they used to love to do, whether it be go for walks or chase the ball. Maybe it's jumping on the bed or jumping on the couch, or even getting into the vehicle. They used to just jump right in, and now they're reluctant, or they wait for you to pick them up and give them a hand. Weight definitely can affect it, because as those joints have inflammation around them and things of that nature, the extra weight will exacerbate the inflammation and cause the pain to worsen. We do use anti-arthritic medication, and going back to the consistent exercise will help even with those pets that seem to have some arthritis. You know, you wouldn't want to wait all week and then on Sunday think, well, let's go jog 3 miles. It would be really difficult for them. But if you go for a walk around the block every evening, the consistency is very good for those pets, even with arthritis.
Excellent. Well, thank you so much for joining us. That wraps up our show for tonight. Our thanks goes out to Dr. Brandon Wiedenhaft from Big Creek Veterinary Services in Hayes. Next time on Doctors on Call, our topic will be cardiology. You can email questions for us at our next program at doctors@shptv.org by Tuesday at noon. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Half an hour went by that fast.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital. Experts, neighbors, friends.